Warning, I want to talk to you about some things that I see in the ER. These are generally findings that I see in patients who are overweight or obese and heading towards becoming type 2 diabetic. This is something that I call the type 2 diabetes triad. The triad represents three clinical signs, the first of which I noticed in our weight management clinic and visualized these signs for years while working in the ER. The first part of the triad are elevated liver enzymes, specifically ALT and AST. ALT and AST are enzymes produced in the liver. Their elevation is often a sign of liver injury. The second finding in the triad are pre-diabetic skin changes. The most common skin change I see is something called acanthosis nigricans, or a darkening of the skin around the neck or on the elbows or skin creases. Acanthosis nigricans is often accompanied by other pre-diabetic skin changes such as skin tags. And because of the tools available in the ER, such as CT and ultrasound, I've been able to literally visualize the manifestation of pathology associated with pre and type 2 diabetes. The third finding in the triad is something called fatty infiltration of the liver. Fatty infiltration of the liver is where the liver architecture becomes congested with fat. Fatty infiltration of the liver is one of the most common causes of elevated ALT and AST. Here's a normal, healthy liver, and here's a liver that is literally congested with fat. So the triad consists of these findings that I've seen over the years: elevated ALT and AST, pre-diabetic skin changes, and fatty infiltration of the liver. So why is this so important? It's important because most of the people that I see with these changes don't have a clue that they're in trouble. In fact, surprisingly, their blood glucose is often found to be in the high but normal range. They're overweight or obese, but they're completely unaware that these changes are occurring at the cellular level. In fact, it's not uncommon for their doctor to have told them, everything looks pretty good, your blood glucose is normal. But the changes leading to type 2 diabetes often go unnoticed for years, until one day, more prominent symptoms of diabetes suddenly appear, and finally the diagnosis of type 2 diabetes is made, leading to an ever-increasing cascade of medications, and often the addition of insulin when oral medications fail to keep blood glucose under control, and the potential for developing a myriad of health impairments. If you're unsure if you have any of these findings, take a picture of this slide and ask your doctor to check for these signs, so your doctor can help support you in your efforts to reverse course. My goal is to help you become healthier with each passing day. I'll see you in the next video. Hey, I'm Dr. Richard Kelly with Type 2 to Health. If you like these videos and you're trying to live a healthier lifestyle, subscribe to the channel, stay tuned, and I'll see you again soon.